Good evening and welcome everyone. Now we are moving to English session. Today is our 1542nd day of continuous webinar. Thank you all the participants, all the faculties. And before beginning the session, we will have a silent prayer. Good evening once again for our 1542nd day of continuous webinar. Today's our guest is Dr. VIBHA MEVADA SHARMA. She has already taken classes for us. She's a director at VIBHA's Homeopathy in Ghaziabad and Noida. And she had done PG courses, certificate and master course in advanced homeopathy. And she had treated many difficult and successful cases. She is author and speaker at different national and international platforms. She is a yoga protocol instructor and currently she is running 2 homeopathic courses. And she received many appreciation from many organizations. And today's our topic is ENEURESIS. And I'm welcoming Dr. VIBHA MEVADA to IFPH platform. You're welcome, Doctor, please.
Thank you so much, Doctor. Thank you so much for the kind words and the introduction. I'm sharing my PPT. Just a minute. Please permit me. Yeah.
Yes, permitted.
Yeah. Okay, hope it's visible now.
Yeah, visible. Can you make it large?
Yeah, doing. Okay. So good evening, everyone. This is Dr. VIBHA MEVADA, and as we all know, our today's topic is about ENEURESIS. In this presentation, I'm going to present 2 my case studies, which are the solved cases of ENEURESIS. So before going to start my presentation, I just like to dedicate all my knowledge and success, all my things to my gurus. So everyone, when we are talking about the ENEURESIS, in simple language, in common language, it's called bedwetting, which is a very common problem, as well as which is a very common ignoring problem also, right? Because of the unawareness when to see doctor for this condition, right? So the enuresis is a Greek word, yeah, which means to avoid urine. So it's a repetitive inability to control urination. So when we defined this condition, it's an involuntary urination while asleep after a certain age of period where we are expecting the normal urination. So when we see the incidences of the condition, so generally the accepted is that the 15 to 20% of children are getting bedwetting up to the age of 5 years, where the male patient, the male kids are more prone to get almost double to get the same problem in comparison to female childs, right? So worldwide, if we see the prevalence of enuresis among 6 to 12 year of child, and is reported as 1.4 to 28% of the child. If we see the cause of enuresis, why this condition develop and how this condition develop, so in our country, a very common problem is UTI, that is the urinary tract infection, which can cause the enuresis. Other one is the sleep apnea is there, right? Other than that, the anatomical defect where the bladder size is not normal, right? It's smaller than the normal. That's why the it get full easily, and the patient doesn't get that sense of full of bladder, and the involuntary urination in the night time is there, right? Other very important factor is the production of antidiuretic hormone, that is ADH. If this hormone is imbalanced, which is responsible for slow urine production in the night time, if it's there, definitely then the urination at night time will be there, right? So these are some very common and important causes of enuresis in kids. Whenever we are treating something, we should know the risk factor of that. So, in a kid's life, stress and anxiety is one of the very major factor we can found in enuresis. Stress, anxiety, fears, right? So what are the stress of at that age? So at that age, the main stress, the main anxiety is about to start a new school, when they are going in a new school, when they are become the big brother or sister, means new sibling enters in their life, when they are sleeping away from the home at some other place in the hostels. So these are the stressful condition in kids life. Other than that, a very major risk factor is family history. When the condition is running through the family, if the parents or the grandparents gone through the same condition at their childhood, this kind of childs are more prone to get enuresis in their lifetime, right? Other than that, ADHD is a major factor where bedwetting is there. So, very important for the parents when to see a doctor when we have this very common problem to attend. So, if a child is getting getting wet bed up to or more than the age of 7, definitely it's an alarming sign to watch or to visit a doctor, right? Other than that, if a child have started a wet bed after a few months when a dry period is there and again reappearing of the bedwetting is there, that is also alarming sign to visit a doctor. Other than that, if there is pain in urination, if there is the color appearance of urine is different, like it's a pink or red, if unusual thirst is there in the kid, definitely you should see the doctor at that time. Other than that, if we talk about the symptom, how can we make a diagnosis that this patient is belonging from the enuresis, right? So definitely bedwetting is there. So wetting during daytime or during nighttime is the symptom of enuresis. Other than that, the frequency, normal frequency, if the repetition of urination is very high, then you can thought of enuresis. The urgency means child cannot hold on urination till they go to the washroom. That is also a symptom of it. Burning is there in the urine. Drop by drop urine is passing through the day when they laugh or when they are playing, like that. As we said, the color is different, like pinkish in color, or there is some constipation. Constipation can also develop that, because if there is unable to control the bowel movement, then the urine control is also can, they can't unable to control the urine thing also. So when we see the enuresis, there are a very simple classification of enuresis for understanding and for making a proper diagnosis. So broadly, enuresis is classified under two parts, on the basis of symptomatology and on the time of appearance. So when we see about the time of appearance, it's again subdivided in primary and secondary enuresis. Primary enuresis is when there is no dry period till the age of child, and the secondary enuresis is when already dry period is up there for more than or up to the 6 month of a month of the life, and again reappearance of the enuresis, again reappearance the bedwetting, that is the secondary enuresis. If we see the subclassification on the basis of symptomatology, there is again two parts, monosymptomatic and non-monosymptomatic. When we see the monosymptomatic, it's nighttime waiting, bedwetting is there only. And when we see the non-monosymptomatic, it's a presence of nighttime and daytime, both time the waiting is there, right? When just try to understand the terminology for day and night. If it's there at night time, it's called a nocturnal enuresis, and if it's there in the daytime, it's a diurnal enuresis, right? So let's see. We'll try to more understand the topic with the help of cases here. Today, I'm going to present two cases. One is of a primary enuresis, and other one is of a secondary enuresis, right? And I request all the participants to. It's a one. It's not just a presentation. It's a discussion for more understanding. So just attend the cases carefully, and at the end, give your analysis, evaluation, whatever the rubric selection or the remedy suggestion of your and what you understood in the case. So let's start our first case. So this case is of a 10-year-old male child. So chief complaint when they visited me, the chief complaint is of a bedwetting since childhood, right? That's why it's a primary enuresis. Urine is profuse and sticky, which is aggravated, means the bedwetting is more in winter season, and the number of urination in the bed at every night at 3-4 times, which is very high actually. And the same complaint is there with the father also at his childhood, means the family history is also there, and they took already homeopathic medicine before visiting to me, which give them the temporary time period of relief. Other than that, according to mother, school teachers are also complaining about this child that in every period he wants to go for the toilet. Means a period is of 40 minutes of time duration, and after every 40 minutes he have to go for washroom. If other than that, if we see the two more complaints are there, that mother noted that there is a white dots are there on his nail since last 2-3 years, and the same thing, white marks are also there on teeth with the same duration of time. Further, when I proceed for the case, so whenever a kid if is of a 9 year or elder than 9 year, I used to talk alone with the kid first. So when I talk to him, he start explaining about himself like I'm a good boy because my mother said that if I am studying well, I am good. So I feel I am a good boy. Other than that, he said, I love to play cricket. I want to become a cricketer. Then he is like, my sleep is getting disturbed. I'm sleepy at the daytime. And when I ask why, so he's like, 3-4 times bedwetting is there. And after passing urine, he get, he wake up and then he want to change because he's feeling uncomfortable. And then he sleeps. So sleep is incomplete in the morning. So after that, he explains when I ask him what you feel about your problem. So he just says that I have fear. So I got some anchor point to you know to ask more questions about the case. So when I ask about the fear, what fear is there? He's like, if my friends comes to know about my bedwetting problem, what will happen? So I asked, what will happen? So he's like, they will annoy me, and what you do if they will annoy you? He's like, I'm going to cry. If they will annoy me, I'm going to cry, and I will feel helpless there. Means why he will cry, and also he's like I can't do all my things alone because he need the help from the friends. He's like I can't do my all study things alone. My work will remain pending if my friends are not going to help me. I will left behind, everyone will go away from me, and what will happen if all this thing happen in his life? He is like I will feel alone, and if I'm alone, what will happen if I got ill? How can I cover my syllabus? How can I do studies if I ill without my help of my friends? And if this thing happens, no one will going to talk to me if they come to know about bedwetting. Then he's like, I'm not able to do anything if I'm alone. And what finally he feels that I never be complete, and I'm unhappy if this type of things will happen in my life. Then he explains about himself more that I have lot of friends. I can make friends very easily in my trip. If I go, he mentioned that I go for that trip and I make that person friend there, and that friend is still continue with me. Means he is not the one who can easily break with any friendship with anyone. So when he explains about his studies and his interest in the studies, he is like, my favorite subject is mathematics. And what he like a lot in mathematics is he explained that I love to solve difficult questions. When my teacher try to explain to everyone that be aware students, this question is very difficult, so put all your focus to understand it. He is like, when the difficult question comes up, I feel good because I am good with the difficult questions. I love to solve them and I can do that easily also. About his hobbies, he is like, I love drawing, I love playing piano, and I love cricket as well. When we see in the dreams of kid, first thing is that uh, kids are very, children are very good to explain their dream because they can't think much and they have so many dreams to explain, and they can explain very well also. So this child explained about his dream like, I saw repeatedly a dream that I'm fail in my class test, and after that I'm crying a lot, and then I feel like everything is gone west. And what is west is like whatever efforts I put to study to give this test, to prepare for this test, everything gone west. And another dream is there which is about the horror dream. It's he But the horror dream is only when he watch something horror or read something horror in the newspaper or in the TV or something. After that only the horror dreams are there. So whenever someone have any dream under the influence of some acute incidents like watching movie and then got a horror dream, that's not considerable, right? The repetition dreams, if someone have the repeated dream of the same kind, that have value to consider in the analysis. A very important point for a children's cases, that is mother's history during pregnancy, right? From where we can understand a kid better, from where we can understand the MISM better, right? Whatever mental, emotional things a mother can suffer during her pregnancy, we can found the same kind of nature sometime in the kid, same kind of suffering in the kid. So many times I experienced this thing in my practice. So in this case, mother is emotionally and mentally she was stable. She's like, I can't feed him initially for the 15-20 days because the delivery was there 15 days before the expected date of delivery, and the condition was the fetal heartbeat was reduced. That's why they did the C-section. Another very important thing for the children's cases, that is to rule out the milestones, right? So here the almost all the milestones are on time, like talking, walking, crawling, holding the head, everything is on time here. When I talked to the mother about the child, she explains like he is very stubborn child, right? And he is very friendly as well. As he explains that I can make friends easily, that is completely right thing. What mother also says the same thing about him. Then he said that she explained that he have a fear of dark. He will not going to enter in the dark room even in the daytime. He need mother actually. If he want to go for the toilet in the night, he will never go alone there. He always need me to be with him. If we talk about the academics of kid, she said that he get A grade in all the studies always. He is very good in mathematics. He always want to win the game whenever he is playing with the friends. He's like he always want to win the games. And for that winning, he can cheat even sometimes. And if someone else win the game, he feels jealous. But he is not going to do something bad for the person those who win. And he loves cricket a lot. So when we inquire about the family history, so father have the same problem of enuresis, right? The paternal grandfather have diabetes, paternal grandmother have hypertension, then maternal grandfather had cancer, and maternal grandmother have diabetes again, and two maternal aunts have thyroid hypothyroidism. The kid have extreme desire for the cheese, sweet especially, and chips, right? And he is averse from the cold things. He is ambithermal, and there is perspiration in head and neck. When we go on the physical examination and observation, definitely got white spot on nail and teeth, and nothing major is there. Physically, if we see the physical appearance of the child, he is lean, thin, and fair child. So, so this is the case, right? And until I'm describing about the miasmatic understanding of case, I just expect some suggestions about the medicine, about rubric, and about your understanding uh, of for this case. So when we see the miasmatic understanding of this particular case, so this case is belonging from the tubercular myasm. And why tubercular myasm? Because the qualities of tubercular myasm we got in this child. What are the qualities we got here is the first is the activity. He is very active. He have clear perception. He have goals. He is very friendly. He shared all his things very easily and very openly, right? He is very talented as well. Yeah, a vibrant and attractive drawings are there, which all represents the tubercular myasm there, right? So before going for my analysis, if anything there in the chat box, let me check there. Okay, not till. So because time is less, I just feel to proceed here. So when we see the analysis, what are the main points on the basis of which we can select the medicine on mental, physical, and general level? We can consider to put all those points in the analysis, right? So here in this case, on mental level, what are the important points we got in the case is there is for sure the fear of dark is there. He is a dependent child, as he explains about his friends and studies and all. He needs support. There is desire for company, otherwise he feel alone, as he explains already. He is very friendly, active, intelligent, and a stubborn child, as explained by mother. And he is very affectionate also. Other one, if we see on the physical level, so bedwetting is there definitely. The profuse urine is there, sticky urine is there, and we got for sure spots on nail and teeth, the white spots. In generalities, the major things what we find is the desire for cheese and sweet, which is there for the foe mark, and aversion for the cold things. And sweat is there on head and neck. So when we put all these analytical points in the rubric to use repertory here, what we found here is on mental level first, the rubrics what I select for the case is mind, fear, dark of, mind, fear, alone being, mind, obstinate, headstrong, as he is a stubborn child, mind, dependent, mind, company, desire for, and mind, affectionate. And for the other important top points, we can take the rubrics like bladder, involuntary urination, night incontinence in bed, right? Which is the main chief complaint of the patient. The urine is strong odor, urine offensive, foul, putrid, head perspiration is there. Generally, it is food and drink, sweet desire, cheese desire, and cold drinks aggravation. Other, when we put all these rubrics in our repertory chart, so following medicines we are getting in the first, second, third, fourth number, right? So I just want to mention one thing here. We took case, we analyze it, we put all those collected data of our understanding in the repertory. But this process doesn't confirm the medicine selection here, right? Because whatever we are putting in the repertory chart and selecting as a rubric is our understanding, right? And what we got here as a repertory chart is just what our mind understood about the particular patient, which is not 100% confirmation, for the selection and prescription of a medicine. So after repertorization definitely helps for the prescription, but after repertorization, I always like to prefer materia medica first to confirm the medicines which are there in the repertory chart, right? So here the calcarea carb stands first, right? After that, the pulsatilla, sepia, natrum. So let's rule out the medicines which are here and what I prescribe for the case. So my selection for this case is a calcarea phos. And why calcarea phos? See, calcarea carb definitely stands first in this repertorization chart. And after 5-6 medicine, the phosphorus is also there, right? But why I select this medicine, I will tell you, right? So when we talk about the calcarea, definitely the dependency will be there, right? Because if we see the calcarea phos remedy in the soul of the remedies, which is by Dr. Rajan Sankaran sir, he mentioned there that the ability to make new connections also comes from the phosphorus element. Because if we see about the calcarea carb never going to talk first with new people, right? There is hesitation, there is fear, right? So this quality of connecting new people easily, making friends easily, even in travel, this thing comes from the phosphorus element, because phosphorus is like that. Phosphorus can make people friend very easily, because phosphorus is the element where the main quality is to mix up like a water with peoples. So calcarea phosphorus peoples are friendly and make friend easily. They love travel. Calcarea phosphorus person tend to make a new home where they go. Right? That much comfortable they can make other peoples with them. So this is the quality of phosphorus element. And other than that, the dependency is there, the fear of darkness is there. All these qualities come from the calcarea. Other than that, if we see in the same materia medica, they explain generally there is a perception that calcarea is a fatty, flabby person, right? And we see the buildup of this patient is lean, thin, and fair, right? So when we see the calcarea phos, they are lean, thin people. There is spots on nail, right? But calcarea might be means can be a lean person like calcarea phos, right? Other than that, calcarea phos is a tubercular remedy, as we discussed already about the miasmatic understanding and the qualities of tubercular miasm there, right? And if we see in the Allen's keynote, there is a thin spare subject is there instead of fat. This is about the calcarea phos. This calcarea phos personality is lean thin, right? So let's see the differential diagnosis. Yeah. So first we can start with the calcarea carb for sure. So as I prescribe calcarea phos, I can rule out here why I prescribe calcarea phos and not the calcarea carb. So first thing is about the myasm. Calcarea phos is in the tubercular myasm, while calcarea carb have the mesomorphosoric, where the psychotic is dominant somewhere. If we see the constitution, the physical appearance, calcarea fos is lean thin. Other than that, the calcarea carb is a fatty flabby, right? If we see about the mentality, the mental state of the patient, calcarea carb is a slowness, sluggishness is there, both on physical and mental level. Whereas exactly opposite, because of the phosphorus element in calcarea phos, the activity is there. They are active, very active physically and mentally as well. When we see about the feeling, the main feeling. So when we see the constitutional medicine and the quality of them in the calcarea carb and phos, the main feeling of calcarea carb is of about the need for stability and security, right? Whereas the feeling of calcarea phos is I am not loved at the place of security, and the place of security for them is home. So they are feeling unloved somewhere. And that's why they are looking outside home. Why they are mixing so well with the people? Because they are like, if I am making you feel that much good, they want the same thing from the other peoples also. Yeah, that's why the calcarea force is like that. If we talk about the cravings, so calcarea carb have craving of indigestive foods, pencil, egg, milk, chalk, and calcarea phos have cravings of meat, fish, spices, potato chips, like that. Yeah. So this is the main differentiation why I choose the calcarea phos and not the carb for this case. Other than that, why I choose the calcarea phos only? Why not the only phosphorus prescribed for the case? Right. So the main theme, if we understood about the phosphorus, is of being unloved and uncared, especially from the close ones, means in the home. So patient react by being affectionate, friendly, and sympathetic in the hope. They have the same hope from the other peoples also, to whom they are behaving very nice. They are behaving loved. They want in return the same affection from the people. And they are very sensitive. If they are not getting the same affection, they got very badly affected. Yeah, that's why the effort of phosphorus is therefore is in the direction of caring for others, being sympathetic for others, because they want the same thing for them, because of the insecurity feeling of their own, right? If you see the other medicines, why I'm ruling out this medicines, because in our repertory chart these medicines are there, on the second part, second stand, third, fourth, fifth. That's why we are ruling out and try to understand the differentiation of these medicines. So pulsatilla was also there in the repertory chart, which is almost covering all the rubrics there. But pulsatilla is of a psychotic miasm. Yeah, the main feeling is of a softness. Yeah, they easily can yield people, right? Because if the main thought of pulsatilla is, if I want to survive, I should be soft and gentle. That's why they are very soft, gentle. They yield easily. If you talk about the netomure, the main feeling is of that the betrayal, the disappointed feeling is there, to whom they are dependent. Netomure want the one-to-one relationship only, right? Other is arsenic album. If arsenic is there, restlessness should be there. Other main thing of arsenic is they are always feel like a threat feeling is there. They feel like everywhere around them thieves are there, and they are weak, and that's why the people is keeping eye on them, and they can, you know they can thieve them anytime. That much threatening and chaotic condition is there of arsenic. And other things are there, like they want their things very well, keep on the right place in a right position. All these things are there, right? So definitely my prescription was calcarea for this case in 200 potency for single dose, and the rest SL was prescribed for next 30 days. When I see the first follow-up for this case, the urine was twice in a night, right? So instead of 4 times in a night, the urination is there on twice a night, and because of that, the sleep is better. So as I see a good prognosis of the case, I put it on SL for the next 30 days. In the second follow-up, the as it is condition was there, right? So that's why I repeat the same medicine with same potency, right? And in third month also, the same condition was there. So now, instead of changing the medicine, first always try to manage with the potency, right? So here in this time, I prescribe the calcarea phos only, but in a 1 m potency, the single dose of 1 m potency. And after the 1 m potency, first time for the first 12-15 days, he never pass urine in the night. Yeah, and after 15 days, once at night, urination is started there. Yeah. So as I saw, after the 1 dose of calcarea phos, 15 nights are better. So this time I prescribe the same medicine in the same potency, but twice in a month. 1 dose after every 15 days. And after that, in the fifth follow-up, in a whole month, the bedwetting is there for twice only, and which is a very good prognosis for the case. That's why I put it on SL then. I doesn't want to disturb that work or the effect of medicine. So just put him on SL. And in the next follow-up, again, there are no any symptom, like in whole month bedwetting was not there. A smell of and stickiness and the foul odor of this urine is not there. Daytimes are going normal, right? Like his class teacher even mentioned to the parents that as he required urination or go for the washroom every after every period, now it's not there, right? And at that time, we checked that it's for the white spots on nail and tip, which is 60% reduced. And with that, I just put him on SL only for the seventh follow-up, and for the next time, after the observation of 2 normal months, we stop medicine for the case. And this is how we solve this case. Okay, any question for this case, or can I proceed for the next one? Because time is running.
Proceed, doctor. That will be.
Okay.
One right hand.
Can I proceed?
Yes.
Yeah, okay. So the second case is of a secondary enuresis, and it's a very interesting case actually. This case is of a 14-year-old female child. Yeah. So according to parents, both the parents are come to me with this child because they are very getting frustrated with the child because she is 14-year-old when she go for relatives and everywhere, so they are feeling insulted that this child is bedwetting at up to this age even, so what they explain is कि bedwetting is started since last 3 to 4 years. Yeah, and it's there once in every 2 to 3 days. Only in the night bedwetting is there. At daytime everything is normal. They took lot of allopathic medicines for that without any relief. And the parents are like, we scold her a lot, we beat her a lot to not do this behavior. we feel a shame in between the people when we are visiting to some other place, and because of her we are not staying to other places because we know the bedwetting will be there and all. So all these episodes will there with the parents. Other thing, other complaint what kid told me, that is the acne. Since last 1.5 years, the acne are there. Itching is there on that, and she's already taking the some medicines for that. Mother explained that she have a irregular menses as menarche start a year back only, right? Which is normal actually. So parents started narrating about her first. So in this case, I talked to parents and kid first, and after that, when the parents are complete with their complaints, then I request them to. I want to talk to the kid in alone actually. So initially they started like she forgot the things very easily. In last 3 to 4 years, she doesn't have any concentration in the studies. Before 3 4 years, she was quite good in the studies, but now in this 3 4 years, she have no concentration in the studies, and they're like she have to must do the things what we say no for them. She is very irritable nowadays. She answer backs very rudely to the parents now, and she is like when if she is get angry, she cries like mad. We just feel like what happened to her, why she is crying like mad suddenly. And they're like we scold her to leave this habit of urination, but the things are not going well, right? So when all this thing happens, I just request parents to go out, and I just want to talk in alone with this child, right? So when I started talking to her, she is like, I forgot soon what I learned. Whenever I started learning nowadays, since last 3 4 years, I forgot things. I used to learn, I used to do studies, but I forgot them. Then she started narrating that I like dancing a lot. I love to listen music, and how to learn. She's like, I have problem to learn with the big answers. When I see a page of answer or a half a page of answer, I just give up there. I like to learn only 4 5 lines of answers. Yeah, because I can remember that much only. And she's like, nowadays, I'm not at all interested in studies, especially when my parents are scolding me a lot about the studies and all. Right? She's like, bedwetting after getting cold is high. Whenever she was watching horror movie, out of fear, the bedwetting is there. Then she told that out of fear, the bedwetting is there from the horror movie and all. Then I asked her what other fears she have. So suddenly she started talking like, I have fear that someone is doing something to me, right? And when I give some space to her to explain what she want to say about this thing, like someone doing something to her, she explains that she is getting physically abused since last 3 to 4 years. And after that, bedwetting started. And she is like, out of fear, I can't share this thing to anyone till now. And she just requested to please share this thing to my parents. Yeah. So any specific dream is not there in this case, right? So here we got the cause, the element of the disease here. When you inquire about the family history, the father have diabetes, and not much thing is there in the family history also. Right? Generally, it is she have a desire for sweets and sour things and averse from the spinach. And one thing she mentioned that she have desire for the cold water with ice, right? And she is very thirsty. Like she used to take 4 to 5 liters water in a day. Thermally, she is ambithermal. She explains about the perspiration that perspiration is very scanty on scalp and behind knees. Perspiration is there, which smells very sour. The stain of perspiration is yellow, right? So this is about the case here. right? So let's start solve the case together with the understanding of MISM first. So definitely this case is belonging from the psychosyphilitic MISM, yeah, where the psychotic MISM is predominantly present here. Why? Because she covered up things since very long and she's suffering there, right? Which represent the psychotic MISM, the domination of psychotic MISM there. She hide things, she have forgetfulness, and of course the fear is there, right? So when we see the analysis on mental level, there is fear which causes analysis, yeah, enuresis, sorry. Unwillingness is there because the things what are going in our life is represents some unwillingness of her, which is the element of her complaint, yeah, and the forgetfulness is there. On physical level, involuntary urination is there, sour perspiration is there, and perspiration is tense yellow. On general level, desire for sweet, sour, and cold, icy water is there. Right? So following are the rubrics for the case. There is rubric of mind, fright, fear, aggravation, element from. Mind undertakes things opposed to her intention. Yeah, because whatever is going on is just she is not willing to be face these things. Forgetfulness is there. Bladder, involuntary urination, night, incontinence in bed, perspiration sour order, perspiration yellow stain, and all the generalities, desire for sweet, sour, and the cold icy water. Right? When we put all these rubrics in repertory chart, again the CPI stands first with covering all the rubrics here, and the only medicine in the repertory chart which is covering the all the rubrics of the case. Again, for the confirmation, going through with the materia medica first. So when we see the Soul of Medicines by Dr. Rajan Sankaran sir. So this book I prefer a lot in my practice whenever I got chronic cases, especially when we see when I got the theme of some medicine there. Definitely, I go through the Soul of the Remedies first. So the main feeling of sepia woman is that she is forced to undertake things opposed to her intention, which is the main element of complaints in her life. Yeah, which is directly we can understand by this paragraph our case. To do what she doesn't want to do. It is a chronic situation in which she has been dominated and not allowed to her own way. Right? Other thing in the same materia medica, she feels forced to accept situation against her will because of her feeling of not being good enough. Yeah, in boric materia medica, it's given the involuntary urination is there in the sepia. Again, in Soul of the Remedies, it belonging to the psychosyphilitic miasm, the remedy sepia. And in Ellen's keynotes, it's there, enuresis, bed is wet almost as soon as the child goes to sleep and always during the first sleep, right? So definitely the prescription is of a sepia here. So let's see why not other remedies. So as I already explained about the arsenic in the last case, not going to um, explain it again. So other one is the veratrum album. Veratrum album is I think second or third position in the repertory chart. So it's very important to rule it out. So the main feeling of veratrum is the loss of his social position, and they want their social position by hook or crook again, and that's too sudden. And for that sudden gaining of all this social position or loss of business or anything whatever happened, they choose the wrong ways like gambling, lying, fraud, cheating in business and everything. Right? That is beretromalbin. In sulfur, the humiliation feeling is main in the sulfur, the embarrassment feeling is main in the sulfur, right, which is not there in our case. In China, if we see, so China, the main feeling is I am weak and so people attack on me, trouble and torture me, which is the belonging to the fixed phase, and it's a main psychotic remedy. Other let's see few more remedies before most resemble remedies, like remedies which are very close with sepia, right? So first one is the tarantula, which looks very similar to the sepia. The theme of tarantula is unrequited love and the need to be attractive. Like we know very well the tarantula dancing, attractive hysteria, all this there in the tarantula. And common to both both and a young sepia can often seem like tarantula, but tarantula can also be very industrious, very industrious, right? Which is not there in sepia actually. But here again the emphasis is much more on attractive behavior and the contradiction of will as we found in the sepia. Yeah. Other remedy is lachesis. If we just try to rule out sepia and lachesis, the differentiation between these two medicines. So sepia come close to lachesis with its envy and dream of snakes are also there in the sepia. But in lachesis, the emphasis is more on keeping herself attractive. Lachesis are always in the competition for the look. Hmm. they they can the cheat and all these things are there more there in the lachesis, and in sepia there is despair, there is no hope in the relationship is there. If we see the natrum mure, try to understand the differentiation between these two. So sepia comes very close to the natrum mure. Both have the theme of disappointment in love, right? And the theme of the body being disfigured and dependency of natrum mure is much greater than sepia. Natrums are very much dependent in the relationships, right? The main problem of natrum mure is not between the relationship and occupation, as in the sepia. In the main problem of sepia is between the relationship and occupation. In natrum mure, there is one-to-one relationship only, right? The whole theme of one-off relationship and not two separate theme of occupation and relationship. This is there in the natrum mure. Yeah. Also, natrum mure has cheerful after coition and there is confusion after coition in sepia. If we see the noxomica, so the acute of sepia is noxomica. So in the cases where we are constitutionally prescribed sepia, some acute condition means acute exacerbation of some chronic diseases is there or some acute conditions appears, we can prescribe noxomica there with indication only. Yeah. So noxomica is concerned with occupation and business with tremendous irritability is there in noxomica. And many other symptoms are similar to sepia, like they are chilly, they are constipated. In acute situation of business failure, as I told, in any acute situation where we prescribed already sepia as constitutional, noxomica needed there, but with indications only, right? So definitely the prescription for this case was sepia 200 single dose along with the SL for next 30 days. So as the element of this case was very clear, and because of that particular problem she was getting the bedwetting, and as she requested to enclose all this thing to parents, so I talked to parents that day only, and after that very soon she was better because the ailment we can find out very well, and our ailment was substituted from her, right? So after the first dose only, bedwetting once in the last in whole month, one time bedwetting is there only. Her acne has started reducing. There is no itching in that. I doesn't prescribe any medicine again. Doesn't repeated any dose. In the second month, there is no bedwetting was there, no itching, no acne, everything is going fine. Again, put her on the SL for 1 month, and after in the third month, after third month, as no complaint was there, we stop it. Yeah, so this case I consider as one of the rarest case of mine where I prescribe single medicine with single dose. Right? So very few number of time it's happened that I used to prescribe single medicine, but single dose can cure a whole case. It happens very rarely actually. So this is all about today's cases. So if we talk about the enuresis, so when as we see, it's a very common condition, right? So parents can manage this thing, with some with understanding some things like giving limitation of fluids before bedtime, going to the washroom before the bedtime. The bladder therapy is there, where we have to, if the size of bladder is small, we have to uh, explain the kid to try to hold on the urine for some time and then go for it. And the counseling make a major factor, because it's very commonly asked, and in our daily routine you can easily listen about the enuresis. But when a child is going through this phase of bedwetting, is that period of time is very mentally damaging the child. That's why I think the counseling is very important to with that kid. As we see in the first case of our what the imagination of that child is. If my friend come to know about my bedwetting, what will happen? They will not going to talk to me. I will be alone. I will be unhappy. So that much emotionally a kid can get impact with this very common problem, right? Other one is, what are the complications if we see? So definitely the guilt, embarrassment is there, self-esteem is there, loss of opportunity for social activities out of the fear of bedwetting, definitely. So here the counseling can help a lot. Yeah. Other thing, what is the conclusion for this problem? So problem of enuresis should be solved with 5 P's regimen, that is praise, patience, perseverance, passion, and a positive attitude. So if we are presenting, or parents can be with all this thing with the child, this problem definitely a child can face or pass out this problem easily. Yeah. So this is about today's presentation. Thank you so much. Thank you for inviting me again on IFPH platform. Thank you so much.
Thank you, Dr. Vibha. It was excellent case presentation, evidence-based, detailed case presentation, and it was really I think everyone absorbed the case. That how you looked the case, likewise we also absorbed. And
Yeah.
after your first case itself, Dr. Selvi Postaglu, she's raising her hand. Dr.
Mm-hmm.
Hi, thank you, Dr. Vibha. Very wonderful
Thank
case
you.
and very wonderful, excellent presentation. And based on organon, you are treating your case, and at the same time, you did a very brilliant differential diagnosis. And I'm very happy to hear from you some things. And thank you for IFPH, because every night we learn a lot of things, and we met your lot of wonderful doctors doing wonderful homeopathic treatment or their case. Thank you so much.
Thank you
Thank
so much, doctor, for patiently attending this session. And I thank to all the participants. And definitely, if you talk about the organon, without the understanding of organon, we can't face the challenges of homeopathic practice without understanding of organon. Because everything from selection of medicine to case taking to follow up to selection of potency, everything is depend on the organon only. So instead, we have a lot of things for the materia medica, that we have to learn this medicine, this materia medica. Everything is there. Materia medica is important, no doubt, but organon is as well very important.
Yes, you're right. Thank you so much.
Thank you.
Thank you, Dr. Sevgi, and thank you, Dr. VIBHA MEVADA, on behalf of IFPH and for all the participants. I am thanking you again. Now it is a time for our Malayalam session. Come again and teach
Thank
us.
you.
Now we are moving to Malayalam session and inviting Malayalam moderator for conducting Malayalam session. Thank you. Good night. See you same time tomorrow.
Thank you.
Thank you so much.
Thank you.
Dr. Mariamma John, I will. Okay, doctor. Okay. You can start.
നന്ദി അജിനി ഡോക്ടറെ.